this whole debate or discussion around efficacy, you see, when doctors and epidemiologists talk of efficacy, it's a very different thing from what we understand as efficacy. If we can please spend some time on explaining what efficacy means, what is the emphasis on that, and how a vaccine could sort of prevent a severity of the disease. I mean, either of you could take it, or I mean, if both of you would like to take it. So Vikram, question to you. When I see some news reports, something is 91% efficacy, or 91%. The value is 91% of efficacy. In another, it is 63. What does it really mean?
Yes, that's a great question, and I'll get started. One is, so the vaccine should be seen under two lenses. One is whether it prevents infection or not, and the second thing is, if it doesn't prevent infection, does it prevent severe infection, the infection that brings you to the hospital or to the ICU or further on? Now, the different vaccines, be it AstraZeneca or the Pfizer or the J&J, have different variations in the amount of efficacy they have in preventing infection. But all of them have excellent, more than 95% efficacy in preventing an infection that is severe enough to make you come into the hospital, come into the ICU, be on life support, or die. Now, that's a big difference to understand, because yes, infections are bad, but infections that are bringing you to death's door are the ones that you really want to prevent. And I can assure that all these vaccines, based on significant data on millions and millions of people, prevent the severe form of the infection in a very, very potent way, more than 95% of the way. The different vaccines prevent infection in different ways, but taking the vaccine, the 2 shots of most vaccines, will avoid you from getting the severe form of the infection, which is the major factor in our decision making. Right, Chowdhury?
Yeah, no, absolutely. And I think when we talk about efficacy, it's on a very large population that we are talking about. Something is always better than nothing is what we've always said. And even if you talk about, 60%, 80%, 90%, it's quite a huge amount of, chances that we are going to be immune to severe disease. Mild disease, having flu-like illness, is what is going to become a way when COVID becomes an endemic in the times to come. So we're not going to be spared that, but we really don't want to lie in hospital, lose our lung function, be breathless for a very long time. And to prevent that, as Vikramjit said, most vaccines have shown over a 90% of efficacy in preventing severe disease. So it is definitely worth it, whichever vaccine is available, to take it. And then for boosting up in the future, there will be lots more to hand.
And because the vaccines are only about 2 months or 2.5 months old, it is probably too soon to say that there is enough empirical data from the ICUs that you are in, that, well, there was somebody who was vaccinated and then has come to the ICU. That's my broad reading.
Yes.